doing this presentation for us.
So I'm Sylvia. I'm with Advanced Urgent Care. I'm their territory manager, which means on a normal basis, when it's not a pandemic time, I am dealing with DOT, non-DOT, physicals, drug testing, breath alcohol testing, any sort of thing we would do for a company to help them keep their employees safe in those regards. So I'm the liaison between Advanced Urgent Care and employers. We have hit into pandemic times. And what I'm going to do today is I'm going to go through COVID. What's your response as an employer? What's your response just personally? I'm going to try and diffuse the situation a little bit for everybody just so that we know how are we keeping ourselves safe? How are we keeping others safe? What's just media craziness and what's actually something that we need to pay attention to? I was actually just at one of our on-site COVID clinics. We do free clinics for the community. If you are underinsured or uninsured or, in the homeless population, we have days throughout the week, throughout the Denver metro, where we will do free COVID testing for you. So you have to forgive me, I'm still a little cold. I'm drinking my coffee right now to warm up. But first of all, I'm not gonna bore you guys with a bunch of slides. I personally hate PowerPoint presentations. And if any of you guys wanna chime in at any point, please do. Just ask me the question as we go. I know Zoom's a little awkward for that, but we'll just go from there. The very first thing I want to talk about is just sort of demystifying COVID-19 for everybody. Just so you guys know, I'm not a doctor. So if you guys do run into any situations, I highly recommend you call your personal physician or you call a nurse. Just because I'm not qualified for that, but I will give you guys the information, like I said, just to demystify it. As far as COVID-19 is concerned, we are doing massive amounts of testing currently. The reason we are testing currently to the levels that we are several fold. Many times when you have to travel right now, you are required to get a COVID test. I know a lot of locations like Hawaii or the Virgin Islands are requiring COVID tests before you can actually land on the island or get on the plane. We have a lot of schools coming back in. We have a lot of organizations coming back in, so we're testing a lot for that. We're also just testing because employers are nervous about it. We have a lot of testing to where employers are calling us and they're wanting their whole, team tested to make sure that there's not an outbreak within, close working ranges. We're also testing a lot because, quite frankly, it's cold and flu season. We're heading into the winter months. People are getting sniffles or they're getting a sore throat. So, with that COVID thrown in there, we're doing those tests for that as well. Some real, just basic things we can think of to just protect everyone. The masks, whether you feel great about the masks or don't feel great about the masks, right now they're mandated in a lot of places. It's been highly politicized. I would say as far as the masks are concerned, if it makes someone else feel better, you're out at Costco, what have you, keep that mask on, keep it over your nose. As far as the social distancing, of course, that helps. And that helps with flus and that helps with colds as well. We're very social creatures. So I don't know how long that'll last, quite honestly, but when you stay away from other people, you stay away from other people. And then the most important thing, of course, is the hand washing. We touch surfaces all day long, all day strong. And if we can keep our hands clean, we're just protecting that next person who's, you know, opening that doorknob or what have you. Other than that, CDC is saying that you are considered exposed to COVID if you are within 6 feet of someone for more than 10 minutes. So if you think about it, on a daily basis as we run through our day, most of us are very rarely within 6 feet of someone for more than 10 minutes. So I'm just gonna take out that fear factor on that. It's pretty rare. I'm sorry. I can't hear you. June, were you trying to do something? I can't hear you.
Sorry, Sylvia.
That's
I'm on
okay.
the phone with Rob trying to get on.
Okay, no worries, no worries, no worries. Let's see. So yeah, so if you think about it, I'll start again. If you think about it, you can kind of disseminate that fear that if there was a positive COVID in your household, you probably all need to get tested. But if you're just walking around, going to Costco, going to King Supers, we can kind of get rid of that fear for everyone on there. Let's talk about testing within our own personal scope. Does anybody have any questions on that before I get started? No?
I have a question.
Sure.
So are these, how much do these tests cost?
So we're gonna get there. We're gonna talk about
Oh,
that
okay.
because there's different ways that we can go about getting this stuff done, okay? So first and foremost, there is free testing available, and it's available to our community, and it's available through the CARES Act. And if you go onto advurgent.com, you can see where our advanced urgent care, we call it MOBI, it's our mobile unit, is available throughout the city. Now, this is money that's coming in from the CARES Act. So it's basically the local municipalities that are paying us to do this. And what we are doing is we're just setting up a vehicle clinic, essentially, and anyone who comes through can get a free rapid test. And then we send you your results afterwards. If you happen to be positive, we send you an invitation to come speak to one of our providers if you would like to do that. If you're negative, you just get a text message saying you're negative, and you can move about your day from there. So there is that free option that's there. What I will say about the free option is that it's a 2 to 3 to 4 hour wait a lot of times. And depending on where you are within the city, Aurora has a significant wait time. So you will spend about 3 hours in your car waiting for that swab to get your COVID test back. However, it's free. So if somebody doesn't have insurance, or if they're homeless, or if they're at all concerned with it and they don't have the means to pay for a COVID test, that's your free option, okay? Now let's say you're someone who has insurance. What you would do is you would just call into one of our clinics, or you go online to one of our clinics. You set up what's called a virtual visit. If you're paying cash for that virtual visit, it's $130. If you have insurance, insurance is covering that virtual visit. And then you just do a virtual visit with one of my providers. And you would tell the provider, hey, I've got the sniffles, I've got this, I've got that. Or you would tell the provider, I'm going to Hawaii and I need this clear COVID test before I go to Hawaii. And then what they would do is they would order you a COVID test, depending on what kind of test you needed. Some people only need the rapid test, which is a 15-minute from swab to result. Other people need the lab test, which is called the PCR test. The lab test gets sent out to a lab. It takes 3 to 4 days for that to come back. Okay? So the virtual visit, if you're paying cash, is $130. If you have insurance, it's typically covered by insurance. The actual COVID tests are each $95. Right now, insurance is covering the lab tests, and some insurance is covering the rapid test, but most are not. So if you're running it through your insurance, they'll cover that lab test, they'll cover that $95 fee, but if you request the rapid, one of my clinic members would ask you for $95, or they would give you the receipt for it and you could try and turn it into your insurance to try and get that covered. Okay? That's for you personally. That's for if Sylvia has the sniffles and she decides she needs a COVID test, that's the procedure I would go through. Now, do you guys have any questions about that part of it? Yes.
Hi, Sylvia. So I have a question. Is there considered official testing versus non, I'm probably using the wrong verbiage, but I've heard around town that there are tests that are recognized by the state and some that are not. What's that determination? Is that true,
Okay.
or can you demystify that too?
So when the rapid test first came out, there was a concern about efficacy between having a tech do it and running it through our machine and having a tech do it and sending it out to a lab to come up with whether or not it's truly positive. Some organizations, there's nothing across the board. That's just urban legend on that. Some organizations require you to get the lab test that gets sent out because of that fear of efficacy. What we have seen within our organization is the Sophia unit, which is the rapid test, and the test that we're sending out to the lab, we're getting the same level of results back from them. So we see about a 10% on each side positive rate. So what that's telling us is that both of these are working towards the same efficacy. Okay? Some organizations, if you travel to Hawaii, for instance, I had a lady that had this issue. The resort she was staying at requested specifically that they wanted the lab test and not that rapid test for her. So you have to make sure that if you're getting this test for whatever reason, you clarify which test they want. That's the only thing that I've seen different there. However, like the NFL, all they use is the rapid. That's all they're using right now is that rapid test. So they're not even worrying about that lab test. They're using the rapid test. And one thing I should say about exposure that I missed in that last section there, and I apologize for this. So as far as exposure, CDC says if you come up positive with a COVID test, you need to quarantine 10 days from exposure. So if your spouse is positive and you're positive and you guys have been intermingling this whole time, you should probably start your quarantine 10 days from when you got the positive, okay? If you think you got exposed outside of the house 3 days before you actually took the test, then you only have 7 days to quarantine after that, okay? We see heaviest shedding of COVID to where we're spreading 2 to 5 days. So 2 to 5 days from exposure is where we see where we're really spreading, okay? So any more questions on that side for you personally?
So I was wondering,
Go ahead.
along the lines of if somebody in the family does test positive and the other members don't test positive, and that person has to quarantine for 10 days or 7 days or whatever, how do you make, what do they tell that positive person how to prevent it from spreading to the others?
So more than, that's a tricky one. So more than likely, if, like, let's say I tested positive and my husband didn't test positive, more than likely he's still positive. He's just not shedding as heavily with the virus to cause that positive on the test. So what they've been telling is that if you guys are living closely, which most families do, you all pretty well need to quarantine. Together, not alone, but together. A lot of people are very asymptomatic with it, and a lot of people will get the virus and not necessarily show up positive on the test because they're not, what we're doing is we're going into the nose and they're just not shedding that virus as much as everybody else. I know everybody loves my graphics on that, right? So what my practitioners have been telling people is that if one person in the house is positive, you should behave like all of you are positive.
It's just confusing.
Unfortunately.
For when, like, I think it was Columbine or one of the schools where they had 100 kids were exposed. So they were saying, well, those kids need to stay home, but their siblings could still go to school. And that seemed silly to me. And I didn't know how, if there was something
silly.
magical saying.
Yeah, there's no magic to it. It's a virus. The kiddos, so with this virus, the kiddos are really not having a tough time at all. And honestly, if you're a mother of young children, you've probably already been exposed to the SARS virus to a point where you're not necessarily going to get the same kind of reaction that someone who hasn't been exposed to it will. My nurses will tell you the people that they worry about the most with COVID, the elderly, I would say 60 and above, we need to be very careful with. And not to say that 60 is elderly. I know 60 is the new 40. And then the other thing that my nurses get very, very concerned about is any sort of obesity rates. As soon as they see a patient with, a high BMI, they're pretty concerned if there's that exposure to COVID. So those are the two. The little guys, we really have not seen. Most of them walk around like they have nothing going on, quite frankly. Some kids could have a reaction to it, but most of them walk around like they have absolutely nothing going on. And that's because they've been exposed to that SARS in some form or another in the past, through school, through preschool, through everything that we just do as human beings. Okay? More questions?
I have a
Anybody?
question.
Yes.
I have a question. What is the difference between like a flu, how they test for flu compared to COVID? Is it basically the same thing, or what is that?
So it depends on the flu test that you get. Some actually go in through your throat, through the back of your throat. A lot of flus present more in your throat than they do in your nose. When they say upper respiratory, we're talking about this area right here through your sinuses and through your nose. COVID has presented more through your nose. So that's where we're aiming the testing at, because that's when we want to look for those virus cells, we're looking for those virus cells towards the beginning. So that's kind of where it starts, is right up in here. So we do have some flu tests, depending on the flu, on the strain of flu, that go through the nose. Those aren't pleasant either. And then, of course, everyone's had the strep test. That's a swab to the back of the throat. as well. So it's just depending on where the virus, where the flu, where the bacterial infection is kind of starting out. That's where we're trying to swab. So, yeah. And we can do blood tests for all these things. Blood tests are weirdly not as accurate. Whatever virus, whatever flu you may have will present through your mucous membranes a lot faster than it will present through your blood. So, not to get too graphic, but your boogers tell us a lot. Okay. Any other questions? Nobody? Good? Okay. So I'm going to move on to the employer section of this. The employer part of this is a little tricky right now. So what we have done with advanced urgent care is we have told employers that if you want to send in your employees, what we will do is we will just test them. No virtual visits, no anything. We just take the authorization, we take the appointment, and you just send them in and we test them. And then we provide the employer as well as the employee with the results. The cost of this is a flat $95. That's billed directly to the employer. We have a lot of employers doing this right now because they do not want an outbreak in their place. Here is what I would say to that. It's always good to keep your employees safe. That's the business that we're in. But you have to keep in mind that this is a snapshot in time. So if we're sending in 150 employees at 11:55 on Thursday, at 11:55 on Thursday, they're all negative. That doesn't necessarily mean that they won't become COVID positive as of Friday or Saturday or what have you. So all of this gets sent just directly billed to the employer, $95 a pop. And however the employer wants to deal with it is how the employer deals with it. But basically what they're saying is we want this person tested. We're just going to pay the $95 for the test. I think it's a good thing, but I will see how this pans out. And not to get political on anybody or anything like that, but I do know that we might be heading into, as far as employers are concerned, some sort of litigations situations where, you know, somebody says, you know, my employer, you know, exposed me to COVID. I'm not sure if that's going to happen or not in the future, but we'll have to see how that kind of plays out. I know, and I forgot the senator's name. Lindsey Graham, does that sound right? Some senator was trying to make sure that businesses couldn't get sued over it. But we will see how that plays out sort of politically and sort of if the pandemic keeps going. If we're seeing higher exposure levels. The really nice thing about COVID right now is though we are seeing higher numbers as far as positives, we're seeing less hospitalizations and we are seeing less deaths. So our doctors, our nurses are doing a really good job of taking those people who are positive and making sure that they don't die from this disease. So, and I think we've learned a lot in the last 7 months, just with how to deal with, you know, if somebody elderly gets exposed, if there's exposures within a nursing home, what's our protocol in those regards to make sure that we keep the rest of the population safe in those regards. Does anybody have any questions on how it's working for the employer side of things?
I have a question real quick.
Sure.
So the situation with HIPAA and everything, an employee can get the COVID, but nobody's allowed to say anything about the employee getting COVID. And how are you supposed to know who and what's going on if you're not allowed to give any information or have any of the information because of the HIPAA law?
So here's how this is worked around. Just like with drug testing. So let's say I'm your employer and I send you in for a drug test. I would get the results of the drug test as your employer, and you would get the results of the drug test as well. It's a stipulation of working there. So I'm getting the results, you're getting the results. I decide if I want to hire you or not. With COVID, same thing. I'm your employer and I'm sending you in and I'm paying for the test. I get the results, you get the results. I know if you have COVID, but basically because you went in and took the test, you gave me permission to get your results. So if I get the results and they're positive, I'm not going to fire you over it, right? What I'm going to do is I'm going to say, okay, we're going to put you in quarantine for 10 days. We're going to test everybody who is around you just to make sure that they're not positive as well. So that's the workaround in that situation. Just like you're basically consenting to me, let's say I'm your employer, we're doing a drug test, and you agree to go in and do that drug test, you've given consent for me to get those results so that I can hire you. Same thing. So it's just a matter of consent. So if I say, and I'm so sorry, I forgot your name and it's not showing up on the screen.
I'm Devin.
Devin, okay. So Devin, you walk in and you're presenting symptoms and I say, hey Devin, I'm gonna need you to go take a drug test or take a COVID test. And you say, okay, I'll do that. Great. I get the results, you get the results, I paid for it. So we're making sure you're okay and then we can get you quarantined afterwards if you're not. Okay? If I'm the employer and I say, hey Devin, I'm gonna need you to go take a COVID test because I'm not particularly excited about the way you're looking right now, even though you're a gorgeous lady. So good looking lady. So I'm just not, like, I'm a little worried, you're looking a little peaked, and you tell me no. Then I need to make the assessment as your employer whether or not I even want you in there. And what I would say as the employer, if you tell me no, I'm not going to go take a COVID test, I'd say, well, then I need to send you home for 2 weeks to quarantine because I'm not sure what you got. So for the safety of your employees. So that's the workaround on that.
So then at that point, when you say that you need to go home and quarantine for 2 weeks, or if they went in to get the test and it takes 3 days to get the results back, is the employer responsible for paying the employee, or do they collect unemployment, or how does that work?
So that's the tricky part of it, right? So as an employer, I would never send anybody in for anything other than a rapid test, just because you get the results back in 15 minutes, okay? So I would not do a lab test as an employer because you want to know right away whether or not you have exposure through your whole organization, okay? So I would send nobody out for anything but a rapid test, okay? If they come back positive, they're going to have to quarantine, and then depending on your organization is depending on whether or not you're going to pay them. Now, I know with your situation, it's a bar. So from what I've been told, not that I've ever bartended, I've always wanted to be a bartender just because I like alcohol. But But what I've been told is if you don't work your shift, you don't get paid. So, I mean, that's the part that's tricky right now. That's like, and that's actually what's holding up the second half of the CARES Act that they're trying to do, is because they're trying to figure out who's going to be responsible for that person's pay if they're out for 2 weeks. So when I work with like Liberty, the frat guys, they will send them home. They send them home on sick leave. But they have the bennies to do that. So they can send them home and they still get paid for the 2 weeks on sick leave. I don't know how you guys would do it at the bar. I really don't. And I'm almost thinking you would, whatever you're sick, let's say, so here's my question. If somebody gets sick at the bar, like not at the bar, but they get sick and they have to be out for 2 weeks, would you pay them or no?
No.
No. Yeah. So I would say that almost has to be that. And then they looked for funding from, maybe they're furloughed for that 2 weeks and they can draw some unemployment or something like that at that point.
But for me, I would rather them be safer than sorry. And if they needed the money, not try and come back.
Yeah.
Yeah. So I don't know.
Yeah. So, and that's part of the reason why a lot of employers have opted to just send their people in, because that gives them access to whether or not they're really positive or negative, which is a sad state of affairs, quite frankly. But some people, some companies have sent in people, they've told them to go get the COVID test and they don't have access to that information because they didn't pay for that COVID test. And then that person came back and lied about what their results were. And because of HIPAA, we can't share those results unless the employer is paying for it. So that's the world we're in. More questions? No? Okay. So what I've covered, advurgent.com is the resource you can find to find where our bus is if anybody needs a free test. And I encourage people, if you need that, if there's somebody who's uninsured, if there's somebody who's underinsured, if there's, a family that that just doesn't have a whole ton of money, I encourage you to get online, show them that resource. You will have to wait, but it's free. And when I say free, the cities have paid for it. It goes through that CARES Act money. That's for all of us. So it takes a little bit longer, but if it's a last resort, it's a last resort, and we can get people tested and we can have them know whether or not they really need to see the doctor or not. Okay. And then the second part of that is, if I'm just a person and I'm just going in, yes, my insurance will cover it. They're going to cover my virtual visit. They're going to cover my lab test. Be ready to pay for that rapid test if that's what you want. Okay, that's a $95 fee on that rapid test, so be ready for that. The other, as far as like travel is concerned, make sure you know which test they want. Do they want the lab PCR test or do they want that rapid test? Are they cool with that rapid test? Okay. And then as far as employers are concerned, we have that single, just send them in, test them. You all know it's the flat $95 fee, just the flat $95 fee. I do know that we do have one location in the Commerce City area where we do take our bus for the free testing. It's on Friday nights. It is from 2 to 7 p.m., I believe. You get lined up, and it's online. So if you have anybody that you need to send, Friday night's your night in Commerce City. We like to party and we like to do COVID tests on Friday night in Commerce City. So more questions. More questions.
What's the location in Commerce City, Sylvia?
Yes.
What's the location in Commerce City?
Oh, let me get it for you. Give me just a sec here.
You can also send that to June if you'd like.
I was going to
afterwards.
say, why don't I just send out, I'll just send out an email where all our locations are. We do have a clinic that's in the Central Park, area that you can get tested as well, which used to be Stapleton. I'll always remember it as Stapleton. I keep wanting to say Stapleton, but I'll send out that, and I'll also send out our clinic locations as well, just so you guys have them on hand. So. More questions? That hopefully I dispelled a lot of the fear with COVID too, because I really don't want people to be afraid of something like this. I want us all to take care of ourselves and to take care of our employees and to take care of our neighbors. But I think in this day and age, we can all come together and get through this pretty quickly. So.
Why don't you tell everyone about, because your company has, been exposed a lot, but I know that you have told us in the past how, none of you have been affected so far.
So far, thankfully. Keep in mind that we always say PPE is for you and for me. So that's why I'm saying, like, if you're at Costco, if you're at King Soopers and they're asking you to wear the mask, please wear the mask. My nurses do it all day long. And they wear N95 masks, and I've actually got a little bit of a scar from an N95 mask that I had to wear the other day. Those tend to fit a little tighter. But yeah, we haven't seen, I guess when I look at it in the media, there seems to be a lot more of a rage to it. We haven't seen that in the Colorado area. And I think part of the reason is that we tend to be pretty athletic. We tend to go hiking, biking, all that sort of thing. So a lot of us are pretty physically fit in comparison to the rest of the country. At the same time, I think we're a lot more spread out than the rest of the country. We're not in New York where we're living, right on top of each other. So that definitely helps. But yeah, we have testers I had 3 testers out testing people. We tested probably 150 people just this morning in the 2 hours that I was at that event. We just keep it safe. So, and I think, like I said, if I can dispel any of the fear to this, let's do that. I do believe testing will let us know right away if you've got it or not, so then you can take the initiative on your own to separate yourself from other people. So I think that will help. There's one thing with virology as well. Viruses tend to be really hard and fast initially, and then viruses like to keep their hosts alive, so they will over time lose their oomph. One example is Spanish flu. When Spanish flu came over, it was World War I. We had all our soldiers coming back, and Spanish flu raged through the US. And nowadays, you have the flu, you might have the Spanish flu, but it's not to the same level that it was that first couple of years. So did that answer your question, June?
Yeah, I did.
Okay. And then anything else as far as resource that I can provide for you guys?
I just wanted to thank you for bringing common sense back into the picture on the health side. I mean, on the side, what we're doing as far as the disinfection and the disinfection processes, it's amazing how far the coronavirus has traveled and how it's changed. Just a part of the coronavirus, and people aren't willing to listen to that or hear it It's something that we've been dealing with for years. And being on this side of it and dealing with the chemist on how to kill it and what the ins and outs are, and watching some bad humans is what I got to say, that are really preying on people's fears and emotions to make money, and that's not that's not what it should be. I take pride in the fact that I've literally turned customers away from ideas that they've had into using because they just aren't going to work. They're extremely expensive, and someone sold them an idea and worked on the emotion. So the seeing you take that part out of it really makes me feel good, because that's what I try to do every single day is dispel the myths and the fear and the terror that's going on. This morning, there's a school of 1,100 students, and a second student tested positive for COVID, and they had all the kids on the buses. They had the kids go in the buildings, called all the parents, made all the parents come. Well, that's less than a 2% rating. If there's two little germ spreaders out of 1,100 students, to me, that's spreading panic and fear. That's
so that's
not being good humans.
0.02% of infection.
And they closed the school today for it and made all the parents, destroyed everybody's day to get everybody to go pick up the kids in Colorado.
Yeah. We should be careful. We should take care of our neighbors. We should take care of our grandparents. We should take care of our friends. But there's just there can't be any panic involved, because honestly, these viruses, since the beginning of time. So if we let panic take hold, then we make silly decisions like shutting down a whole school over 2 kids being sick, who probably honestly hardly had the sniffles on it. People, unfortunately, they have a lot of emotion. And like I said, I feel like this is an issue that shouldn't have been politicized, but that was politicized, and that was driven heavily with media influence. We just need to be good neighbors. And, and that's why I tell people, it doesn't hurt you to wear the mask in Costco. It doesn't. If you don't want to walk around with a mask at home, that's fine, but we still need to go to Costco. We still need to go out with friends. We still need to socialize. We can do things to keep ourselves safe. We can do things to keep others safe. Leading a healthy lifestyle is one of those things. So, let's get some fresh air. It's all going to be over soon. One of these days, it's all going to be over soon.
Sylvia, I wish I could share your opinion on that, but I don't think it's ever going to go away. And I think it's going to continue to mute. It's just a mutant, and it's going to continue to do. The way that things were previous to COVID-19 is never going back. And I can tell you that from our side of the industry, there's no going back to what it used to be. Purell in stores, that won't happen till mid-2021.
Yeah.
It's just is what it is. It's woke a lot of people up, and it's frightened a lot of other people into holes.
Yeah. I can see that. And I do, I just think as a reasonable society, we're going to have to get back to some level of engaging with each other. So some of the solutions you have chemically, that's a great thing for us to have.
1 minute, we got 1 minute kill times on a lot of different products, and a lot of people are 10-minute quaternary kills and don't realize that a quaternary has a binding agent that sticks to that surface. And now if kids go sit on it, now the kids are going to break out and they're going to have rashes all over, because we're over disinfecting with a product that shouldn't be used over and over. And that's where all the misnomers go, is people don't know what they don't know, and they make assumption, and it's creating more problem than it is fixing the situation, because again, they don't know what they don't know, and rather than asking someone that does know, they're basing it on assumption.
Mm-hmm. Well, and that's most of COVID right now anyways, I think.
Yeah.
When I talk to people and they find out very crazy questions for me. That's just quite frank. So
I get calls and ask questions, and then I give all the information that I've been working on since I was 14 years old. And it's funny how they dismiss me as if I don't know what I do know when they called me to ask the questions in the first place.
Mm-hmm.
So
Yeah.
it's all based on fear. A lot of it is based on fear. And as far as the COVID goes, it's not going to go away. I love your idea of we're going to get some kind of normal, but this is the new practice, and all it's going to do, it's going to change. It's going to change a name. The coronavirus will remutate in another few years, and it'll have another name to it.
Oh, okay. You mean like us? Oh, yeah. We'll get viruses forever.
Yeah.
Yeah, that'll never go away. Hopefully we do hit a new kind of normal as far as our behaviors right
Absolutely.
now. Because I just think that there's a better way of going about that. And I think there's a more reasonable way of going about that. But no, viruses, that's since the beginning of time, that'll be till the end of time. So that won't
Thank
go
you
away.
again, Sylvia. You're very
My pleasure. Anybody else have any other questions for me? June, I will send you the map to our locations, and I'll also send you the information on the free clinics. If anybody needs that as well, if that works for you, June. You still on there, June?
I am here.
Okay, great. So I will email both of those to you. That's a flowing kind of situation there. Is there anything else that you guys can think of that you would need